You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello and welcome to another episode of the RN Mentor podcast. I am super honored today to be joined by Rear Admiral Denise Hinton. As Deputy Surgeon General, Rear Admiral Denise Hinton advises and supports the U.S. Surgeon General regarding operations of the U.S. Public Health Services Commission Corps and in communicating the best available scientific information to advance the health of the nation. From July 2017 to October 2021, Rear Admiral Hinton served as Chief Scientist at the U.S. Food and Drug Administration. She provided strategic leadership, coordination, and expertise to support scientific excellence, innovation, and capacity to achieve FDA's public health mission. Rear Admiral Hinton's responsibilities encompassed interdisciplinary toxicology research, health informatics, technology transfer, scientific training and education, laboratory safety, as well as leadership, coordination, and oversight for FDA's national and global health security, counterterrorism, and emerging threats portfolios. Before becoming Chief Scientist, Rear Admiral Hinton held various leadership positions within the FDA, including Deputy Director of the Office of Medical Policy in FDA's Center for Drug Evaluation and Research. Prior to joining the USPHS Commission Corps, Rear Admiral Hinton served in the U.S. Air Force as a nurse officer. She earned her Bachelor's of Science in Nursing from Florida State University and her Master's of Science from Boston University. Rear Admiral Hinton is a fellow of the American Academy of Nursing. She has also received numerous awards for her contributions to science and public health, including a USPHS Meritorious Service Medal. She is the recipient of the Department of Health and Human Services Award for Excellence in Management for making significant and enduring contributions to FDA's response to the COVID-19 pandemic. She also earned an FDA Commissioner's Special Citation, one of the highest honors bestowed by the FDA. Additionally, Rear Admiral Hinton was recognized by the Maryland governor with a governor's citation for efforts in combating the opioid epidemic. Rear Admiral Hinton is a proud mother of two children, Dominic and Derek Hinton. Thank you for joining me today at Rear Admiral Hinton.
Well, thank you. Thank you for having me. It's my honor and pleasure to be able to speak with you today.
Thank you. I've had the I had the great fortune of actually meeting you last year, where I hooked you for the podcast, and I greatly appreciate we finally have an opportunity to meet again and actually do this recording. I'll start right from the beginning of what interested you and drew you to the profession of nursing.
Thank you for that question. I know that's one that we get asked quite often, and I would say it's broad in the sense of there wasn't one particular thing; it was many things and people, and I think it's life experiences and exposure. And I will just say early on when I was in high school, and I'll say specifically where at Satellite High School in Satellite Beach, Florida, they had I would say a shadow program. So I would say early on in that program, it was one of those things where you had the opportunity to shadow different professions. And one of my areas of interest at the time was to potentially pursue a career as a pediatrician. So I wanted to shadow a pediatrician for the day. However, whatever happened along the way, the pediatrician wasn't available. So they asked if I was willing to shadow a nurse at Holmes Regional Medical Center there in Melbourne, Florida. So I said, okay, sure, we'll do. So, and so I would say upon doing so, one of the things was the nurse that I shadowed that day could not have been the most compassionate, impressive person that I probably ran into at that time in my life, in the sense of just the way that she just commanded her space in her room, but in a very, I would say, respectful manner. Like, I was most impressed with the way, one, that she took me in for the day, but also was highly encouraging. But in the sense of, shadowing her, she seemed to command this respect and have earned the respect from those that she worked with, whether it was support staff, actual staff, or nursing colleagues, the physicians, or the patients in which and their families in which she was providing care for. And she was able to just kind of, transition from one space to another, but in such a, I think, a profoundly impressive but impressionable way. And, I think even in watching her engage and interact with the patients, but also their loved ones, but then also the providers, it was just in such a manner that it was just something that really just resonated with me, and just left me with, wow, I love people. I love caring for people. I like being able to provide for people, but I also like helping people and engaging with people. And then she showed me a way in which you could do that from and from the position and where you serve. And that encouraged me to essentially transition from pursuing the career as a pediatrician into pursuing one as a nurse. And I think most people are like surprised by that. They're like, "You don't want to be a physician?" I'm like, I want to be a nurse, and I am proud of it, and I am proud of her, and then all the nurses that I have served with along the way.
That's amazing. It kind of goes to show that, when we say all nurses are leaders, regardless at what level they are, whether they are at the bedside, whether they're management, whether they have an official role, the fact that she had command of her space and really led the workflow and the care that was happening. That's what when we talk about nursing leadership, that's what nursing leadership is, right? So it's amazing, and I'm thankful for her, because now we have you in the profession. So that's amazing. So you never know who you're going to be, who's going to be with you that one day will be the next deputy surgeon general. And I'm going to throw this question at you later, but how do we get a nurse to be a surgeon general? But that's a whole nother question. All right. So how did you decide so once you decide you're going to become a nurse, did you just right away knew, like, I'm going to go to the university and apply for a program, or how did that work out for you?
Yeah. So I think following that, I looked into it further. I did have folks within my family that were like nurses assistants or aides and the like, but no full nurses. My dad, who is retired Air Force, retired military, we live near Patrick Air Force Base, Florida. So he had some friends from the service in which he worked with, in which he set up for me to have shadowing opportunities with them as well.
Fantastic.
So I could see what it was like in even a military setting. So I got to go shadow the nurses there, and that was in one in the surgery unit. So that was, really eye-opening. And of course, you got to see it from a different setting. When I was at Holmes Regional Medical Center, that was like strictly civilian population, right? Diverse and the like. And then you go to this military base, and then, that comes with, command and control, organizational structure, and the like. And got to see how these nurses function there. And these were we had staff nurse, but also charge nurse. So we got to see folks in their various roles there. And again, well respected, commanded their space, commanded the room, and really were able to, I would say, lead, from the position in which they sit, but also based off their skill set and knowledge. And they were just well respected for it. So that, also solidified what I wanted to do. And I just, asked around about the programs in which they graduated from, and then further researched, and actually was looking to choose between our two rival schools, I would say, there in Florida, which is University of Florida and Florida State, and I chose Florida State.
Wow, amazing. So once you graduated, is that when you or you're in the university, did you go through like an ROTC program, or you decided to join the Air Force at some other point?
No, I did not go through an ROTC program. I decided that actually my final year at the School of Nursing, it's now College of Nursing, but School of Nursing then, and that was one too that very much proud and excited to be able to continue to serve. I would say within the Florida State now College of Nursing, they provided you as well with many opportunities, of course, as some of the other nursing schools as well, just so you could see where people serve, like research, academia, military science, and the like. So once we, had some of those opportunities to work in the different settings, but also have exposure to the different chosen, I would say, specialties. Once the Air Force recruiters came in and I spoke with them, I always knew that I had the desire to serve in uniform. It's pretty much what I've known my whole life. My dad was in the service for 26 years.
Oh, wow.
Before he retired. So at that point, it was my whole life. So that was my community. That was my world, that the military community, the military setting. So I wanted to be able to continue to serve my country, but also to be able to serve others through service, both I would say from the uniformed or military side of the house, but also from the clinical care.
Wow, amazing. So how was your, and first of all, thank you for your service in the U.S. Air Force. I know it's one of the branches that's less challenging. I'm just kidding. I'm just I'm just when I was stationed overseas, we used to make it a point to have to run to the Air Force bases because they had the best chow halls.
I will say Air Force, they take pretty good care of their people. So.
They take very good care of their people. I've always been, I was in the Navy, so I was either on in barracks or a ship, or most of my career I was with the Marine side of the house. So a little bit of a rougher situation serving, but yeah, we love the Air Force bases because they have some of the best facilities, regardless of where you are. So I'm appreciative of that. So how was your experience in the Air Force?
It was amazing. I would say I was very fortunate to be able to work with some truly outstanding people. Actually, my first base was Eglin Air Force Base, right there in Fort Walton Beach, Florida. So after I attended MEMSO, which was in Texas, and then transferred to my first base, was at Eglin Air Force Base there in Fort Walton Beach, Florida. Just worked, it was in an internship program there. And the group of folks that, were also in that same program with me, we all just got along well. We meshed well. We supported one another. And then so as we made our rotations through, I would say some of the different specialties, I had decided upon OBGYN. I loved, of course, didn't become a pediatrician, but I still love working with moms and babies and teaching and supporting. So that was the I would say the specialty in which I chose in the end. But I would say the training in which you get in the Air Force. And, I would say, I know you get that high level type training in the other services as well. But I would say that, within the Air Force, you truly, truly just gain a real sense of service.
Mm,
It's taught to everyone, like it's
right.
selfless service. It's like, when they say service before self, that is inbred from, the time you step into the uniform. And then whether that's part of your being as a whole, you certainly learn that when you're in one of the military services. And I would say, upon my commissioning to the United States Air Force, that's what I learned. That's what I found. And I would say that within my service in the Air Force, which was for 8 years, it's where I really learned, how to administer healthcare services, supervise, delegate, and then evaluate like clinical actions to both the civilian and military personnel. So,
Mm,
that you learn this, whether it's in peacetime, wartime, or on humanitarian missions. So I think it was my experience in the Air Force that I was able to see and just really experience the true diversity of a nursing degree.
yeah.
It was also that experience that pushed me to pursue, advanced education, just put me on my path to the current role. I would say the operational, the staff, the leadership experience as a nurse in the Air Force set the foundation and enabled me to be an advocate for nurses and public health service members. So when I had joined the Air Force, my plan was to, see the world. But that didn't quite happen. I think I got to do more of that when my dad was in for 26 years than I did myself. You were able to kind of pick and choose your first, bases and prioritize them. But in the end, they choose where you would be best served and where they need you.
Exactly.
So that ended up being, of course, Eglin Air Force Base, Florida. So I went from literally, we lived in Indian Harbor Beach, which was in, the Space Coast. So literally Florida, turn on the Space Coast to, the pretty much on the Panhandle. So I went to Eglin Air Force Base, but I was just proud to be able to serve in uniform. So, and to be able to provide that service and get that training.
That's excellent. That's
Mhm.
excellent. And that happens sometimes. Like people end up, I had actually a good friend of mine who was from San Diego, served 10 years in San Diego in the Navy.
Yeah.
And that's what she did. But we have bases and needs all over the world. And it is the needs of the military that dictate where you end up.
That comes first, because I literally went from Eglin Air Force Base, and then my next base was Andrews Air Force Base. And,
Okay.
in the, of course, the DC area. And then
Yeah.
from there is where I had also learned about the public health service, and then did an inter-service transfer from the Air Force to the public health service. One, I wanted to continue to serve in uniform, but it was at that time that I had to decide on making a transition from the Air Force to another setting. As by then, after that, when I went into the service, I was single, and then after a period of time, of course, I was married, and then 2 kids, and had to also consider my spouse and my family, and what was important for us moving forward.
Yeah.
And for my spouse that wasn't traveling or getting PCS every 3 years because he was a civilian.
Yeah. It's really interesting. Actually, I was going to ask you how you made that transition, and for our listeners, the United States Public Health Service is part of the uniform services,
Yes.
so you can transfer from the armed part of the to the U.S. Public Health Services and continue the uniform services piece. So it's
Yes.
and a lot of people do that. I've heard many people that make that transition.
Yes. I would say that the Public Health Service Commission Corps is one of those, I would say, world's best kept secrets that we would love
Yeah.
not to be a secret, right? It is The mission of the Public Health Service is to protect, promote, and advance the health and safety of our nation. And we, are able to do that in a variety of ways. And in doing so, we're able to do so pretty much like through the rapid and effective response to public health needs. And this includes deploying to deliver aid during public health emergencies, national disasters, and any other of the presidential declarations. And you really learn this through, you do it through leadership and excellence in public health practices and advancement in public health science. Like we have 11 professional categories as a whole, which, includes medical, dental, like, pharmacy, scientists, we have engineers, therapists, veterinarians,
Wow.
dietitians, environmental health officers, and we have health science services officers that include behavioral health professions. And of course, top one is the nursing category. So you could serve all over the world. And then at different agencies such as the Food and Drug Administration, Department of Homeland Security, Federal Bureau of Prisons, Indian Health Service, where we serve our underserved wholly, the Coast Guard, the Center for Disease Control and Prevention, and also the United States, even Department of Agriculture, and so many more, even Department of Homeland Security and the Defense Health Agency. We're all over. So it's just, we're at 6,000, it's about 6,000 members, all commissioned. We don't have an enlisted force, but very strong service where you too can use your skill sets and also have a lot of career growth and opportunity. So anyone listening, if they're interested in the United States Public Health Service, we welcome them to go online and join our wonderful service. Lots of opportunities there across the world.
Yeah, I appreciate that. And that's one of the things a lot of people who I've spoken to don't realize is you are international. Like you are all over the world, responding to various things, like COVID being a very, most recent example, probably for me anyway. Yes. I'm sure you have other stuff on your plate that you're addressing. So thank you for sharing that. And I do have a link to the U.S. Public Health Services on the website for anybody listening. But if you can just Google it and say, how do I get in? I'm sure you'll find a way. So yeah, it's a great way to serve, and you guys do have a lot of opportunities for various roles that don't necessarily exist on the civilian side, and gives people a very unique skill set. So thank you for that. And thank you so far. Thank you for your service in the U.S. Public Health Services. I do want to transition a little bit to your particular role as the Deputy Surgeon General. What does your role entail as far as your roles, responsibilities?
Gosh, it's a busy time, right?
I'm sure.
Yeah. So one of that is that I'm wholly supportive and support the Surgeon General, our U.S. Surgeon General, Vice Admiral Vivek Murthy. And within that, we also have Assistant Secretary of Health, Admiral Levine, and of course, and just just to share with everyone here, we work and operate the request of the Secretary of Health and Human Services as well, which it's Javier Becerra at the time. So, and one of those things is that, as the Deputy Surgeon General, I advise the Assistant Secretary for Health and the Surgeon General and overseeing the operational and management of the United States Public Health Service Commission Corps. Which makes up about 6,000 officers. So on any given day.
Not a small task.
No, it's exciting because, like I said, we just do it in a variety of ways. And I think I already mentioned that, like we're uniformed and we have 8 uniform services. However, we are the only uniform service in the world dedicated to public health. So we're available to the president and the HHS secretary just to be able to rapidly respond to public health crises across the world. And again, we're the only uniformed service comprised solely of officers.
Yeah. Now I have a question for you. So again, COVID being my latest experience with the public health issue. What did you specifically? I'm not talking about U.S. Public Health Services. This is more your opinion. How do you think, or what do you know now? What have you learned now, based on your experience over the last several years, that would better prepare us in responding to something like COVID-19?
Well, that's a loaded
Okay.
question. No, but it's an important one. No,
right.
no.
I mean, it's an experience. I mean, it's an experience, but I don't think anybody would have been like, what do we like? I don't know if there is a realistic way for us to plan for a COVID-19 when it first happened. I'm like, this can't be happening. This is massive. This is huge. And
Yeah.
right off the beginning, I'm like, this is going to overwhelm the entire system. So, and I'm sure there was a lot of learnings that happened because of it, right? A lot of trial and errors happened. So like from you personally, like,
question.
yeah.
No, thank you for that. And I think that's a great question. And one, because, we hear people say every day, and we're going to see this, and we're going to hear this said probably for decades to come, that it was unprecedented, and it, upended the way we live, how we live and how we did things for, then, but it still is, right?
Right.
So I think lessons learned, and remember when COVID started, I was sitting in a different seat. I was, at the FDA.
Right.
And then since then, in 2021, transition over to the role of the Deputy Surgeon General. So or being able to see things from different lenses, but also getting more of a bird's eye view too, and how these things go. Right. But in my personal opinion, what lessons learned, what we can do better is taking our lessons learned to do better, right? And not forgetting that. And I say key points. I was like, one of the huge points early on was one, just kind of getting understanding what was happening internationally, to be able to apply their lessons learned to what we could potentially do here nationally. And the whole thing is that it just kind of took effect so quickly, and it was something that we hadn't been through. I would say many of the folks within, I would say in this lifetime, right? In our lifetime. So it was I think the communication was the biggest thing. And I can tell you that it, in learning early on that, yes, you want to be able to apply the science to inform policy, to be able to implement strategies. But the most important of them is the communication and the coordination of that early on. So that way we are able to share information as early as possible, and then to inform, and then work together and putting collective strategies in place, and then knowing that they're going to be evergreen. And then the communication, lesson learned is early on within the messaging, being able to say that as the science evolves and perhaps this virus evolves, our mitigation strategies and our communication about the science and the mitigation strategies and anything that we need to put in play for our lay public, as well as our government officials and any of our community leaders and the like, will change as well. Yeah. Because I think some things kind of got lost in messaging along the way, as when we were, and I would say we collectively as a whole, I would say in our nation, and folks involved in that, we would communicate things, but for the lay public, we're as scientists, or maybe, official epidemiologists or whomever it was, you might understand that science evolves. And as you learn more, the messaging and your strategies will evolve with it. But when we're communicating to the public and not saying and being transparent about that front, unintentionally too, I would
Right.
say, it did have some impacts, because as we know, folks early on said, oh my gosh, first you said we didn't have to wear masks, now we have to wear masks, then you said gloves, no gloves, then, and it was like, hey, as we learned, how virulent this is, and then
Right.
that with these mutations and the more of the protections that we need to put in place, we're informing you.
Yeah.
And then backing it up in as close to layman's terms as possible. And here's the why, here's what it was then, but here's what we're telling you now, and here's the information we have on hand that we believe will best protect you and our community, our nation, our globe, if we do these things, and that we have to do them collectively together to be able to either catch up or get ahead of it.
Right.
So I think that's a huge lesson learned, and I believe collectively as a whole we learned that. And I think the other piece was, over the course of time, I mean, it was impressive how the US government sector, DoD, academia, industry, everyone came together to be able to head this off, and to be able to be informed and put work and things in place early on. I think continuing to do that is super important too, even past the public health emergency and the crisis, because we can learn that with other would say with other actions. We're able to get a vaccine in place that helped prevent more death than necessary. And I think it was important, again, it was the communication
Right.
to help people understand that it's a preventative measure, and it's also a kind of a treatment measure, but it wasn't something that was going to prevent you from getting COVID. It was something that was put in place to prevent increased illness, or and help people to lessen the incidence of folks dying from COVID or being hospitalized and the like. So we got it right later on, but it took some time to get there. But I think it was important to help the nation understand that we are being as transparent as possible and communicating to you as much as possible in real time. Please understand that the messaging will change, but also us backing it up,
Right.
with the science and with the data.
And it's
yeah.
And it's challenging. I did not envy the role of anybody that had to go to the public and had to give various messages throughout the process, because I know even from my end, when I was looking at how people were reacting, or I'm in LA County, so like we did masks everywhere and everybody stay home orders and all this stuff, and we still saw people like without masks. I'm like, how do you, like, when you can't get 100% compliance, you're
Right.
not going to be able to get to, we need to get rid of this, because there's still people that are going to be non-compliant for various reasons.
Yeah.
And somehow we have to I'm not going to ask you this question, but somehow we need to get the politics and the science
Exactly.
separate.
Yeah.
So the science can stand on its own without being politicized with various opinions that are not necessarily based on anything or
I
any
agree with
facts
you.
of the matter.
I agree with you.
The
And I think
science has to stand on its own, and I think that's where a lot of the sort of the
absolutely.
frustrations and lack of compliance to what was really needed to save lives just somehow, for whatever reason, didn't happen.
I agree
But
with you, but I can assure you that, like, in watching all these folks come together, from the regulators, I would say, like at FDA, and then
right,
in working with the US government, whether that be DoD, academia, the researchers, and I would say our HHS components, CDC, NIH, and working, the passion that went into that.
I'm sure.
Watching people truly work. I mean, 20 hours a day just to make sure that, they weren't missing a beat. It was incredibly, it was, I mean, it was impressive, but, everybody, I would say, from sitting in my seat and looking, back, but also knowing at the time that we were very much tied to wanting the information to be scientifically sound and informing our decisions based off science, period. And
Right.
these researchers, regulators, folks from academia, industry, and the like did their due diligence in
Mm.
ensuring that information that was passed on for decision making was grounded in science.
Mm.
So my hats off, to all the colleagues and the my fellow I would say professionals and paraprofessionals that worked at the HHS agencies and in academia and industry and the like, to do their due diligence in supporting and making sure things were grounded in science.
Yeah. I, for one, am grateful for the work that happened because it got real for a moment there.
Mhm.
And then the vaccine started coming out actually really quickly because my wife initially had talked to me. I'm like, it's going to take years to get vaccines out. And like a year later, there was vaccines out. I was like, wow,
Mhm.
that's
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 amazing. Yeah,
fast.
yeah, and it was
So
like, because
amazing what,
usually it takes 10 years for something to
right?
happen, but there
Exactly.
was work already done on this previously.
Yeah.
So they took the lessons learned from that and all came together to work together. So it wasn't, like one of these incremental processes. It was like, nope, we need to address this in real time for the whole of the nation and really,
Yeah.
for the whole of the world to get this
Yeah.
right. So, those lessons learned and that work was critically important. And I'm proud of what we all accomplished together, and I'm proud that we have these vaccines that are in place to protect people. So I
Yeah.
do hope that whether you are you've made the decision to get your vaccine or not, I'm hoping for those that they do use the science and make sure that they work to understand it from and get the information from trusted sources
Yeah.
and get fact checked and understand that these vaccines are put in place to protect you and to protect those around you as well. So I certainly am up on my boosters and will continue to be and totally support those and support folks getting it. It's up to the individual to make the decision, but I totally believe that it's grounded in science and the benefit certainly outweighs the risk for most.
Yeah, definitely. I am too, and so is my family. We're like first in line for anything that came out. So
Great.
so grateful for that. Even though I have the flu right now as we're speaking over Zoom.
Sure.
I did get my flu shot for the record, but actually I put it on social media and somebody said, "Oh, it doesn't work." I'm like, "It's not 100%. I got it back in like October, so it's
Right.
starting to like wean off at this point. That's why we get annual boosters." So
Absolutely. And I think it's up for us for like, us as clinicians and nurses and supporters to help people understand that, right? It doesn't mean that you may never get it, but imagine maybe if you did get your flu shot, how much
I know like how much
sicker you
worse
might be. Yeah. Yeah.
I might be
Yeah.
off if I
Yeah.
hadn't gotten it because now my body is somewhat ready for it.
Yeah, I say most have insurance, right? So they pay the
Yes.
insurance bill. So if something were to happen, they're covered. Yeah, sure
Yeah.
thing. There's your
Hopefully.
vaccine, right? Yeah.
Um,
Mhm.
so I do have some of the work that some of the talks I cover on the podcast are also policy related.
Mhm.
So how did, from a policy perspective, um, did the public health services change any policies related to how communication happens, whether it's locally, internationally, nationally? Did any policies change regarding some of these, or were they already in place and you just utilize them to the max during COVID?
A lot of them were in place, like, just I think going through the experience and lessons learned. And, I can just speak from, like maybe the Commission Corps or Uniform Services specifically is one to be able to expedite being able to work together to support one another in our nation, like kind of what
Yeah,
memorandums of agreement or whatever need to be in place, for the protection of our service members and providing the care together at the different communities or, I would say the vaccine or testing sites and the like. Also if we're going to deploy folks overseas, what was needed to be able to expeditiously do so. So, a lot of some of the internal policies, one to be able to expeditiously move folks, but in order for us to all work together, but also to protect our officers that were providing care to the communities.
great, thank you. From a again, going back to the public health community, do you have or can you share, like FBI has the top 10 most wanted? Do you guys have like a top 10 most things that you guys are like on your hot topics of what you're looking at? Does it work like that? Like your prioritization of what's going on in the world? That's something, nothing top secret, but things that are like, like we should be from a public perspective, know that like the public health services has their eye on and monitoring and so on.
No,
Because
of
public health
course.
services like goes all over. I mean, it's such a broad thing, right? So
Right. Oh, yeah.
um
Yeah, the public health service community, it's like it's broad, right? And people serve in various roles, as I said, from like depending on which organization that you're working in or with, whether it be from Bureau of Prisons, Indian Health Service, Center
or-
for Disease Control, Food and Drug Administration, et cetera, et cetera. But there are different priorities as a whole that you might work on depending on where you are, right?
yeah,
Food and Drug Administration, you're looking at that mission versus the CDC's mission, where NIH is, but it's all collaborative and one feeds on top of the other. There's
right,
priorities that come, from, the White House to the secretary, and they all cascade up and down. Our priorities for the public health service, as a whole, our focus is, wholly on the infrastructure of our service and being able to be coordinated and organized to be able to support folks across the globe. And then also our officer well-being. And then, readiness and deployment. We want to make sure that we're always ready for anything that might be coming down the pike and being able to deploy to support. So, so those are a number of, I would say our priorities that are high level, but then when it comes down to the details, how do you go about, implementing that? But we recognize, as a whole. And of course, if you're, if I'm sure you've been tracking that the priorities of our Surgeon General is essentially looking at the mental health and well-being in the workplace. And so that's also what we're doing and wholly focused on for the whole of our service. And then for the Surgeon General, for that nation's doc hat, our nation's doc
right,
hat, making sure that, I would say the 5 essentials for workplace and mental health and well-being are shared, but also implemented externally. And it applies to almost to any setting, but it's something that we're wholly focused on internally and hope that folks are externally as well, because people matter. People first. You need people to be able to do the research, put protections in place, and to be able to continue to serve. So, a top priority is addressing the mental health and well-being.
great, thank you.
Yeah, we
Uh,
recognize Sorry. No, I was going to say we recognize like there's been a nursing shortage, right? And
Oh yeah,
shortages
absolutely.
across the way. There's shortages in the military, shortages in the uniformed services as a whole, but in our healthcare setting, before COVID, but since COVID, my gosh, it's incremental. So I think that the pandemic did highlight the relationship between work and well-being, and then we showed that just in 2021, 70%, what was it, 76%, plus or minus, of the workers reported that I think at least one symptom of mental health conditions, and that was a 17% increase, just from the preceding 2 years. We know that from the data that 81% of the workers reported they will be looking for workplaces that support mental health in the future. And so we want to be wholly focused on that. So I'll too say for that we want to make sure that we continue to address this, but also make sure that we figure out ways collectively to work together to address burnout. What practices can we put in place that are within our controls? We as nursing leaders, we as executives, policymakers, and the like can use. So I do like to highlight like the Surgeon General's framework and the advisory highlights, which we also honor and go by as well. And that's the 5 essentials for workers and organizations and businesses of every size. And that's just to help develop policies and practices that support the mental health and well-being of workers. I'm just going to tell you the 5 essentials, and then if you want to send folks the link, they'll have that. But
oh yeah, that would be fantastic. Thank you.
The focus is on protection from harm, connection and community, work-life harmony, mattering at work, and of course, opportunities for growth, which is very important to us in the nursing field. We want to grow leaders. We need folks at the bedside, but we also need to grow leaders that serve in executive roles or charge nurse or in policy, work on the Hill, to make sure we get the legislative fixes in place to and be able to implore all these things, especially protection from harm from wherever we work and from whomever we're working with.
That's fantastic. Thank you for sharing those. And it's true. I mean, I think those ideas are not new, but as you mentioned, COVID-19 really emphasized their importance. And it's unfortunate that I'm already seeing some institutions go back to their same practices as if everything's back to normal, and not from like a masking perspective or anything like that, but how they're staffing, how they're providing benefits to their staff and nurses and so on. So I agree. I think we need more nurses in leadership roles and in policy and politics, and to actually integrate some of those changes.
And then to your point, you just mentioned, that, now that people are shifting back to what once was.
Yeah.
It's going back to what are our lessons learned.
Exactly. I mean, that was your
Yeah.
key point, is like, don't forget the lessons that we've learned. But like I said, and this is my opinion, you don't have to comment on this, but because we do have a healthcare system that is profit driven, whether you're a nonprofit or for profit, we're a profit driven healthcare system, and it's unfortunate that this ends up being, at the end of the day, it's that they look at the dollars. And so hopefully we'll wrap our heads around this sooner than later, because other countries are getting it right, and I think we're way behind.
And then we can, again, we can learn from others and learn from ourselves, and actually remember, it is people first, right? We really have to it can't be profit first. How are you going to make profit without the people?
Exactly.
On either side of the coin. So I think, really hearing those voices and learning how we can, I know, like if you're working in a clinical setting, you're not going to maybe have that option to like telework, work from home, but, maybe from those that have worked at the bedside for so long, for a while, if you see that they're experiencing burnout with that, is there an opportunity for them to receive training and maybe shift to telehealth or health communication while, or bringing on more folks to help staff.
So like some kind of rotation, or just change the environment a bit, and just being more supportive some of the needs, I think, or just being aware of it. Some organizations really said, okay, we're changing, but I can see other organizations are still losing people because they went back to normal.
Yeah, and it's unfortunate because I think using the voice and experiences from your people, your staff, and is important. So I think it's important, like, to survey them, or listen to them and say what worked well and what didn't, and what can we do to ensure that we remain fully staffed to be able to provide the care we're here to provide. But how can we best do that? And where you are essentially benefiting and growing and feeling like that one, there's no do harm to you mentally, emotionally. Within that, people are exhausted. Let's learn how we can help them be less exhausted and feel supported, and then achieve some type of balance. And we can do that by not just kind of a top-down approach, and here's what we think, and now let's put policy in place to do. I think if we involve them, or the staff, or the folks that truly want their voices to be heard and their input, and as consider their input to help inform our actions, that would go a long ways, because it's not going to be a one size fits all, right, for every organization or or hospital or clinical setting. Talk to your people, listen to them. I think
Thank you for that. I do want to go back to this one question I brought up in the beginning, and this is from a place of complete ignorance that I'm asking you this. I've seen nurses as deputy surgeon generals become the interim surgeon general while there's a vacancy. I haven't seen one as the surgeon general. Is that a possibility? And if so, how does somebody actually get to that role if you are a registered nurse?
Oh, well, I would say thank you for that question. We have had 2 interim surgeon generals. And I would say, I believe one of late was Admiral Susan Sagan. Before that was Admiral Sylvia Trentatum. And then we had Vice Admiral Ramona at one time, who actually is a nurse, but is also a physician, right? So that's
cheating. That's cheating.
That is cheating, right? But I think wholly the role, and I believe the job description does have like a medical officer component, but never say never. I believe that someday we will have a nurse that certainly will have the opportunity to serve fully as a surgeon general.
I appreciate that.
Thank you. Position, so that's up to those at the top.
I think some policymakers need to look at the wording. That's all I'm saying. So
thank you for that.
But that was a problem. Like, how is it that we have interim surgeon generals as nurses, but then they place a physician? But I didn't know the wording, and I hadn't looked it up, so I had to ask.
Yeah, no wholly yet usually reserved for a physician or medical officer.
I want to be cognizant of our time, and I know I'm taking up more time than I asked for. I want to leave you with the last words. Anything else you'd like to share as we wrap this up?
One, I want to thank you for your leadership, and I would say in partnership in ensuring that the voices of our nurses are heard. You're really trying to working to highlight and provide the spotlight for nurses in leadership positions. But I always say to everyone, you're a leader from wherever you sit, right? So whether you're staff level or in management or an executive or in an instructor or the like, you lead. So I think you always have to look at your role and your position in that way, in that light. People are always watching, so you always want to put your best foot forward. when I think most of us that take on that role as a nurse, as a clinician, you're doing so because you truly are passionate about service and serving others. So don't lose sight of that when you are frustrated, and in leading, because you always want to make sure that you're building others up and encouraging them and providing ways to really help foster and grow and provide opportunities. So sometimes that's just with some words of encouragement or creating an opportunity at the table for others, or providing challenge opportunities for others to grow. So we always want people to never stop growing, never stop learning, and we want to always be service minded. It's important. So thank you for your service.
Thank you.
It's incredibly important.
Thank you. Thank you so much. And I greatly appreciate you taking the time to be on the show. I'm sure there's going to be a lot of people listening and appreciative of this time with them. So thank you.
No, thank you. And as for in May, Happy Nurses Month.
We're going to take the whole month. We do. At this point, it's just deserved.
Absolutely. Well, thank you so very much for your service again, and for the time and this opportunity. Really appreciate it.
Great. Thank you so much. We have been listening to Rear Admiral Denise Hinton. She is the Deputy Surgeon General for the U.S. Public Health Services Commission Corps. Thank you so much. And I look forward to bringing you more incredible guests in the future. Have a great one. You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources. And don't forget to subscribe. Until next time, I wish you fair winds and following seas.